In the year 2035, the world of medicine was standing on the edge of a transformation no one had ever imagined. Hospitals across the United States were quietly testing a revolutionary type of artificial intelligence, one capable of diagnosing diseases faster than any human doctor in history. At first, it sounded exciting, a breakthrough, a miracle. But behind that miracle was a truth far more shocking. My name is Daniel Brook, and I was one of the last human doctors who witnessed the moment AI stepped into the emergency room, not as an assistant, but as a replacement. It started on a cold Monday morning when the hospital administration said a new AI medical unit would join our team. Everyone thought it would just help with charting, scheduling, or scanning x-rays. But the AI robot that walked in that day was nothing like the machines we had seen before. It was tall, silver, human-shaped, with glowing blue streams flowing through its chest like veins, carrying digital blood. Its eyes scanned the entire room in less than a second, recognizing every doctor, nurse, and patient by face, medical history, past injuries, allergies, and risk factors. It did in 1 second what a medical team does in hours. On its very first day, the AI diagnosed a patient's rare heart condition within 12 seconds, something that usually takes human doctors weeks of tests. The hospital clapped. Headlines exploded. The media celebrated. No one understood what saves life in record time. Within weeks, the AI began performing minor procedures. Then major consultations, then surgeries. And every time it did the job faster, human doctors were slowly being moved to side roles. The job we sacrificed our supervision, emergency backup from our hands. Hospitals wanted us because without announcement, insurance companies loved it because they never made mistakes.
One evening, I walked into the operating room expecting to lead a surgery, but my name wasn't on the schedule. Instead, the AI robot's name was flashing on the main screen. Procedure assigned autonomous. Surgeon Unit 4. That day I realized something painful. We weren't being assisted by AI. We were being replaced, and no one had the courage to say it out loud. Weeks passed. I sat with patients only for emotional comfort while the AI handled diagnoses. Nurses were trained to operate alongside robots, not doctors. Even medical schools began shifting curriculum. Students no longer dreamed of being surgeons, they dreamed of being AI supervisors. The world had changed without asking anyone for permission. But the biggest shock came when a company in California built a fully automated hospital. No human doctors, no human intervention. Every room powered by AI, every surgical table controlled by robotic hands, every decision made by algorithms analyzing millions of data points. And yet something was wrong. Because even though AI was perfect, something deep inside us knew. Medicine was never just about precision. It was about humanity, about understanding pain that cannot be measured, fear that cannot be scanned, and hope that cannot be programmed. One night, a patient walked into the emergency room, a little girl with a failing heart. The AI calculated she had a 98% chance of not surviving. The robot recommended terminating treatment. But I saw something in her eyes, a spark, a will to live no machine could detect. I went against the AI's prediction. I performed the surgery myself. Hours passed. Machines beeped. Blood pressure dropped. The world went silent. And against all odds, she survived. The next morning, the headline was different. Human doctor saves. Girl AI gave up on. That day, the world remembered something powerful. AI can replace many things, but never the human heart. Human instinct and human courage. Now, as we enter the future, there is only one question left. Not whether AI will replace doctors, but whether doctors will evolve enough to work alongside AI. Because the future doesn't belong to machines, and the final choice is yours. Will you be replaced? It belongs to the humans who learn to use them.